Good morning. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to welcome everyone to today's weekly news conference for the latest in COVID-19 information for the Amarillo community. Let me go ahead and introduce who is on our panel here briefly. We're joined by Amarillo Mayor Casey Stoughton, Public Health Director for the City of Amarillo, Dr. Scott Milton, Health Authority, Texas Tech University Health Sciences Center, Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital, Dr. Michael Lamentier, Chief Medical Officer for BSA, Dr. Rodney Gonzalez, Director of the Amarillo VA, and City Manager Jared Miller. We will open it up to brief statements from our panel members, and then we will take questions from the media who are in attendance. We'll start today with Amarillo Mayor Ginger Nelson. Mayor, how are you today?
I'm well, thank you, Dave. And hello, Amarillo. Most of the questions I'm getting these days are surrounding the vaccines and the vaccine clinic. So I'm just going to take a couple of those real quickly. People want to know, do you have vaccine and when will the clinic be open? That's varying. We knew that our vaccine supply was going to ebb and flow just depending on what supply we get from the state of Texas. And it's coming week by week. So it's coming in weekly distributions. Last week, we received our distribution on Friday, but the week before that, we received our distribution on Tuesday. So it doesn't have a regular flow to it yet. But you can check www.amarilloalerts.com and it will tell you whether or not the clinic is open, what the hours are for the clinic, and who we're vaccinating, like what categories of people we're vaccinating. So that's the best way to know when the clinic will be open and who's getting vaccinated. I've had some questions about, are there options to get vaccinated without having to stand in line? Because maybe you or maybe someone in your family has physical limitations that just won't allow them to stand in line. When you come to the clinic, there's a person at the door that's greeting you. Please just tell the greeter that you're not able to stand in line, or if you're bringing a family member or a friend, just say, we're not able to stand in line and we are wondering what the options are for us. So they will then let you know wheelchairs, other options that can be available. So please don't let standing in line keep you from coming to the clinic to get a vaccination, because we can work around that issue and we want to work around that issue. I had questions about whether the city will be doing neighborhood clinics. At some point in the future, we might be doing mobile clinics, but for now, all of our effort is being put on this one gigantic clinic in the center of our city at the Civic Center. So for the immediate time being, the clinic that we will be operating is that one and that one alone. How many people have been vaccinated so far in our city, and how many people does it take for us to reach herd immunity? I don't have those exact numbers, but I'm hearing that question over and over again. When we opened this vaccination clinic, we emphasized getting people actually vaccinated as quickly as possible. So we erred on the side of having all hands on deck to administer vaccinations. Behind that is a paperwork pile, and Casey may talk more about that. For every person who comes to get vaccinated, there's a small amount of paperwork that we have to do on them, and it has to get entered. And so we're backlogged with that paperwork entering process in order to get all of that data. But Casey will speak about the number of vaccinations that we have, the doses that have been sent to the city, and the number that we've administered. What we don't know for sure are how many of those people live in our city, how many of those people are Panhandle residents, and how many of those people are just connected to the city of Amarillo some other way. So in calculating our herd immunity, we sort of have to know, we have to cull through that data so that we know who we've given vaccines to, and just accurate numbers for calculating what our herd immunity number is. But it'd be interesting to hear from the doctors as well, what kind of target we thought we might be shooting for in order to scratch the surface of herd immunity. Based on population demographic data that we have, the people in category 1A and 1B, those are the people we're currently vaccinating. The Potter and Randall Health District population for those two categories is somewhere around 57,000 people. So we have a lot of people to vaccinate before we've worked through those two categories. And that number, 57,000, does not even include people who have underlying health conditions, who are under age 65, but maybe they have high blood pressure, they have a body mass index of over 30, or they have diabetes or cancer, something that other than age, they're under age 65, over age 18, but they have something else that triggers a high risk category for them with COVID-19. We don't have population data for those folks. So we know it's at least 57,000 plus, lots more people. So if you are in one of those categories and you have not been vaccinated, my plea to you today is for your health, but also for the health of our community, the health of our entire health district and the entire Panhandle. Please come down and get a vaccine. It costs nothing, there's no cost. And really the line's been moving so quickly at the Civic Center, it's not that much of a wait, but it is a huge investment in your personal health. And it is helpful to us as a community to build that herd immunity. So that's my ask to you. And please keep sending your questions. We want to answer whatever questions you have every week. Thank you, Dave.
Thank you, Mayor. Let's now go to Casey Stoughton, Public Health Director for the City of Amarillo. Casey, how are you this morning?
I'm well, Dave. Thank you. So we'll talk about the numbers real quick, and then we can talk about the vaccine, because I know that that's a question that we all have on our minds. So as of yesterday, we had a total of 30,713 total cases of COVID-19 in Potter and Randall counties. 15,778 cases in Potter County and 14,935 cases in Randall County. We have a total of 27,030 recoveries, and we are up to 538 deaths here in our community. That leaves us with 3,145 active cases. Each of the cases do represent a unique individual. The total rolling 7-day positivity average for Potter and Randall counties is at 13%. The positivity rate at the drive-through testing site, which is a subset of that total, is at 29%. And the 5-day new positive case average is just slightly up at 219 new cases per day. The public health drive-through testing site does remain operational, and individuals can call 378-6300 to be screened and directed to the test site. GA32's hospitalization rate for the 25 county Panhandle RAC region has been over 15% for over 2 months now. And yesterday, the RAC's hospitalization percentage was at 21.4%. That means that just over 21% of all hospitalized patients have COVID-19. The outpatient bamlanivimab infusion center is still open, and we're serving patients. We continue to receive or continue to accept referrals from local providers for patients who meet that EUA criteria for infusion. To date, we've treated just over 65 patients with that BAM infusion, and only one has required hospitalization. And so that's really great news for our community. We did move the BAM infusion center this week, and so we had been operating out of a tent there between the two hospitals, and we appreciate the hospital's support in that facility. We appreciate the RAC support and DSHS's support in that location, but we did move the BAM infusion center over to a location just across the street from City Hall. That's at 509 South Johnson, and it was the perfect location for an infusion center. It's a permanent location. It has, it's close to the Civic Center operation, so that's handy for staffing, and then there are some amenities for patients that are really helpful. So we're still operating that infusion center, and if you refer a patient, or if you are a patient who's been referred, then you'll receive those instructions on just exactly where to go when your appointment is made. On the vaccine front, Amarillo has given almost all of the vaccine that has been supplied from the Texas Department of State Health Services. Our clinic at the Amarillo Civic Center is currently operating, and the wait times are short. So if you haven't had your vaccine, certainly come on down. Some highlights: as of Today, we have received 18,000 doses at the City of Amarillo. This morning, we started the day off with 900 doses. And right before we started the press conference, I received a text that we're down to 400 doses. So as soon as we are out, like the mayor said, we will post that on AmarilloAlerts.com. And then just as soon as we get our next shipment, we will post that on AmarilloAlerts.com and reopen our clinic so that we can serve you with vaccine. Our highest throughput day was over 2,800 patients served in one day, and that's a big deal. We're so glad to be able to serve you so quickly. Each day, the wait times were improved, and social distancing has been observed so that we can keep patients safe. We certainly have a lot going on, from contact tracing to vaccination. So I want to just take a minute to remind all of us to stay the course. Masking, social distancing, hand washing, limited gatherings, they're still important as we fight COVID-19. I also want to say thank you to our team at Public Health who have worked tirelessly since March of 2020, that is, as we come up on March of 2021. Our team has worked so hard for so long, and we appreciate your support. I also want to say thank you to other city departments, communications, the Civic Center, transit, library, Parks and Rec, fire, police, environmental health, and so many others. They've served well both during the pandemic and before. And so I could not say thank you more to our team. And that's all I have, Dave.
Thank you, Casey. Let's now go to Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center. Dr. Milton, how are you?
I'm fine, Dave. Thank you. Just a few points I wanted to make. The vaccinations obviously are going well. They seem to be tolerated well with just very few side effects. You know, when we look at these numbers that Casey talks about every week, I still see a significant number of active cases. Now, those numbers are down when we look at, you know, a month or 6 weeks ago, they're down, but they're just still way too high. And the other important number that I always keep an eye on and always like to hear from our physicians, Dr. Gonzalez, Dr. Weiss, and Dr. Lamentier, are the number of hospitalized cases. I think this is really the real reflection of how much is going on in the community in terms of community spread. And those numbers are better, but they remain stubbornly high. So there's still ongoing community spread, and we still need to practice our social distancing and wearing masks until we can drop these numbers down. And so finally, once again, there's a race to vaccinate. And that's been our philosophy here in this community. So we want to vaccinate as many people as we can. We don't want to leave any vaccine on the shelf if possible. So I would encourage everyone to stay in touch with your providers and stay in touch on the website for the city. And when we get more vaccine available, we will be trying to dispense it as quickly as possible. So that's all I have to say, Dave. I'm looking forward to our physicians' input as well.
Thank you, Dr. Milton. Let's now go to Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital. Dr. Weiss, how are you?
Good morning, Dave. Well, I'm frustrated. I'm frustrated with what I heard on the news this morning. So driving into work, I heard that 25 million doses of vaccine have been distributed in this country, but less than 9 million have made it into the arms of people. That's a major problem. What that means is that very few communities have been able to come up with such a successful plan as we have in Amarillo to distribute vaccine. And that's been through the hard work of our city leadership, the public health department, and all our first responders. We say, well, why is this important? Well, Dr. Milton mentioned the term race. So we think that viruses may have appeared on this earth as early as 3.5 billion years ago. Now, that's a lot of time for these viruses to come up with some very useful strategies for survival. And the one they use most is to mutate. When we talk about mutating, we talk about the fact that there's going to be a change in the genetic material of that virus that results in a change in the structure that makes that virus more fit for survival. Now, when viruses mutate, a lot of those mutations are worthless and the virus dies because of the mutation. But we are starting to hear about these variants all around the world, the UK variant, the South Africa variant, the Chinese variants. These are mutations that we're starting to see in this virus that appears to make it more fit for transmission or more fit for survival. Now, the reason that's important is yesterday, over 4,300 people died in the United States from this virus, the highest death toll in one day that we've recorded. That means this virus is raging around this country. And as it rages, it mutates. And so we're going to get more and more concerned about the fact that as it continues to reproduce, it's going to find ways of getting around these tools that we're using against it, our remdesivir, okay, obviously our bamlanivimab, or even our vaccine. So it is critical. And as Dr. Milton said, it is a race against this virus to shut it down and to shut down its reproduction, to avoid this virus from being able to get past the tools like the vaccines that we're using. They're now saying the South African variant may actually make the vaccine somewhat less efficient in covering this than the natural type that we've seen. So this is a big deal. We have got to find these communities ways to use a game plan like we've used in Amarillo to get these vaccines out to people. And I certainly would encourage anyone considering a vaccine, please think very hard about it. Take advantage of the great system we have in Amarillo to get that vaccine when we have it. We're even hearing about other people coming from other communities outside of Amarillo to come here to get their vaccine because they cannot get it so efficiently in their own communities. So it's very complimentary for what we're doing here, but this is critical this vaccine be used. Now let's talk about the Northwest numbers. So we are at 83 positives today. Now, 2 months ago, we were at 130 plus. We dropped down into the 70s, and as Dr. Milton said, it's frustrating. It's just hovering at the same spot. We're always somewhere between 75 and 85 positives. This puts us at 17% of our licensed beds. We were flirting with that 15% benchmark that the governor says, and now we're back up to 17%. We have 52 people in our ICU, 38 of which are with COVID-19. And we're using 19 vents today, 18 of which are going to people with COVID-19. So again, COVID-19 continues to be to consume the bulk of our ICU resources right now. Now, the good news is we have seen a significant drop and maintenance of a lower percentage of outpatient testing. So yesterday we had 11% positivity rate in outpatient testing. We've been probably below 20% for about the last 2 weeks. My hope is at some point we will see this translate into lower hospitalization rates. Right now, we have had 24 people lose their life in the month of January from COVID-19. Now, both in November and December, we had over 70 individuals succumb to this virus. Based on our current rate, we may be looking at somewhere in the 50s by the end of this month in terms of people who have died from this virus. And while I guess that's encouraging news compared to the last 2 months, that's still way too high with regard to this virus. Now, with regard to remdesivir, that's the drug that we're using in the hospital. We have treated 669 patients with this. We currently have 9 patients on it. I had an opportunity to speak with a representative from the company Gilead that makes this drug the other day. And the good news is we, our Northwest, BSA, and the VA are all using this medication optimally. What we know is that if the sooner you give it to someone in the hospital, preferably within the first 12 to 24 hours, the better it works. And even more is most of the time we can stop at 5 days of treatment rather than having to go to 10 days of treatment. So I think in Amarillo, we've been using this medication very well for certainly at least the last 8 to 9 months since it first came out. And then the bamlanivimab, we've got 250 doses. We're working with the city on the infusion center. I think it was great. We had the temporary infusion center. We've had such a good response to this antibody that it makes sense to put it into a more permanent fixture, because I think we're going to be using this for quite a while to come. I've talked to a number of patients who have received this monoclonal antibody, and it's amazing. They all tolerate it very well. And within 24 to 48 hours, they feel much better. So I become sold that this is a great medication, and we need to make a permanent home for it for quite a while, as long as this virus continues. So we really appreciate the city doing that. Please remember, if you have COVID-19, you have to go to your provider, and the provider has to make the referral to the infusion center to make sure that you are an appropriate candidate for this antibody. In terms of elective procedures, we continue to look case by case, but for the most part, we've been able to perform most of the surgeries that are scheduled at the hospital here and accommodate the patients appropriately. Lastly, we talked about how great the nurses have been doing for all these months. And the other day I had a chance to talk to a paramedic who said that over 90% of their transports now continue to be COVID-19. I think I'd like to just point out what an incredible job our ambulance personnel, firefighters are doing. These guys are on the front line, and to say that over 90% of the patients they're picking up are COVID-19, these folks are at higher risk, and they've showed the courage to continue to do their job. So I wanted to point out today just all the very first responders, the frontline responders, what an amazing job they've done. That's all I have. Thank you.
Thank you, Dr. Weiss. Let's go to Dr. Michael Lamentier, Chief Medical Officer for BSA. Dr. Lamentier, how are you?
I'm good, David. Good morning, everybody, and thank you for letting me participate again today. We've been through a long year, obviously, and we're starting a new year. I think we need to start the new year with some renewed optimism based upon how fantastic of a job our city leadership and public health department have done with employing and administering mass vaccinations. We are extremely proud of their efforts. And I think as you read about other places across the country and you talk to your family members, myself included, folks that are back on the East Coast and what they're doing to try to vaccinate, they are nowhere near where we are in terms of some of the strides that have been made to vaccinate those individuals that are in up to the 1B category, as we know. So this is great news for us, and we need to continue to support these efforts, and BSA is going to continue to do so. We currently right now are at 112 patients in the hospital that have COVID-19, and very similar to what Dr. Weiss said, we feel like we're kind of just stuck in this rut of the numbers, what I'm trying to say, that is not really going down lower than this 110 to low 120 range. The same number of patients that we get in each day, we seem to be having leave our hospital, and we kind of hover in the same range where we can't get down less than 100. We can't get down to remember when we said we previously peaked? We thought we peaked back in May of this year in the 50s. That wasn't a peak. This is a peak. And what we're fearing is that what we're going to see based on what's happening in South Texas is another wave potentially, which makes it even more critical for us to get the most people vaccinated that we can and to utilize that resource as efficiently as we can. I want to get back to that in a second. So 112 total patients in the hospital. Of those COVID patients, that makes up a third of our current inpatient census, which is at 337 this morning. We have 74 total intensive care patients, and we have 40 of those as COVID-19 intensive care patients. And of the 40 COVID-19 intensive care patients, 25 of those are on ventilators. So as you can see, our total ICU volume is still very high. We're seeing a greater demand on our ICU beds from non-COVID admissions that tend to be more predominant in the winter months. It's not surprising. What is a little bit surprising and fortunate is that we're not seeing a lot of influenza cases. We still remain less than 1% with our flu cases in-house. So we're not in that technical flu season where we have 5% of isolates or greater positive, even though we know we're in the seasonal influenza season. Our outpatient testing and our hospital testing, similar to Northwest, now is remaining below 20%. We're at 16% for BSA of all tests done that are coming back positive, which is lower than December, which was right around 17%. In October and November, remember, we were in the 30s, 33 to 34% of all tests were positive. So that's a good sign, I think. The reason I say I think is because we continue to see high numbers of admissions. So January month to date, we have had 144 new admissions for COVID-19. In 13 days, 144 new admissions. So when we talk about the census of 112 and we think, well, how many of those people have been there for weeks? I mean, we're not really having as much new activity. We're having ongoing new activity when we've had 144 new admissions that are primarily due to COVID. So again, that's why we can't lose focus. If I switch gears and talk about the vaccine, we have now vaccinated over 2,000 folks that meet 1A and 1B criteria, that are employees, that are medical staff, employees and non-employed medical staff, and also the RAC support staff that has come here and that desire vaccination. So we feel like we've been doing a good job with getting this vaccination communication really promoted with our employees and those folks that meet criteria. And we're trying to be as aggressive as we can with using up just about every ounce of vaccine. We're almost through our first dose allocation entirely. And certainly we sent some of that allocation to the city, which they did a fantastic job, better than we could have in terms of how fast it was administered to the appropriate people. So we need to continue to partner like that because I think it's best for our community. And I want to say a final thing, just to summarize, something that I want to talk about today is what I would call, as it relates to vaccinations, immune memory. You know, it's something that it continues to amaze me, the number of individuals that are candidates right now for the vaccine and are declining vaccination. And I think that what we need to remember and understand is that antibody levels that are generated by a vaccine do not equate to your total and sole immunity. Your exposure to the vaccine primes your immune system, which is a very complex system that involves cells called B lymphocytes and T lymphocytes that are white cells that help to develop our immune response. And it's the immune memory that is triggered by a vaccine for these cells that allows you to develop a much more immediate immune response to either prevent infection or completely, or to prevent a severe infection. So as Dr. Weiss mentioned accurately, we're seeing these mutations occur in the virus that are being known as and identified as variants, and that's absolutely true. However, the fact that you've been vaccinated and you have a white cell, T lymphocyte, B lymphocyte, entire immune system that is able to more rapidly recognize that invader, even if it's changed slightly, increases your likelihood of having a less severe COVID infection, if not preventing it. There have been studies that have been done with the influenza vaccination that show that folks that get annual influenza vaccination are far less likely to get influenza. Or if they get it, people say to me all the time, well, I had the flu shot, but I still got the flu. Yes, but you're also still standing here and talking to me and you didn't die from the flu. And it's probably because the vaccination prevented you from having a severe infection. So we just need to remember that we need to take advantage of this precious resource. If you're offered the vaccine, I would strongly suggest you get it unless you've had a severe allergic reaction to the first dose or to the other contraindications that have been identified or warnings and cautions that we've discussed. But again, I think this is going to be a much better year for us as we continue to push through trying to vaccinate those at highest risk and then getting it into others that are felt to be potential transmitters that are certainly our younger population that are healthier. And many of those we know want to be vaccinated as well. And I think that will happen in due time. So again, thank you for letting me speak today. We appreciate everyone in the healthcare community, BSA, our employees, Northwest, the Public Health Department, Texas Tech. Everybody's been doing a fantastic job this year. Let's make 2021 a better and safer place.
Thank you, Dr. Lamentier. Let's now go to Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, how are you?
I'm doing well. Thank you, Dave. So first, let me just talk about our COVID patients here in the hospital. Currently, we have 9 COVID patients, 7 of which are in the ICU, and 5 of which are on the ventilator. So our numbers, similar to the other hospitals, it's down from what it was 4-6 weeks ago, but it hasn't dropped precipitously at this. It's sort of plateaued. We do not have any more non-veterans in the hospital. We discharged our final non-veteran this past weekend. Now, vaccinations. We have been working on our vaccinations, and we have vaccinated nearly 700 veterans and over 600 of our staff members who have asked to be vaccinated. And you know, one of the things that many people ask is, hey, what about that second dose? Are you going to get it, especially as they hear the limited quantities? Well, I'm happy to announce is this week we received our shipment for our first set of second doses that we begin next week. So that is coming. Our Lubbock clinic did outstanding this week, and on Saturday they vaccinated 170 veterans. They did that in 3 hours. It was a high demand. There were many patients there waiting several hours before it opened up to get vaccinated. I heard a story of a 96-year-old World War II Marine Corps veteran. Bill Passwork was his name. He allowed us to release it. And he said the reason he was there, he wanted to set an example for the community as other veterans to get vaccinated. What a way for the greatest generation to continue to serve and be that greatest generation, to go and say, hey, we need to be vaccinated. So yesterday here at the Amarillo Clinic, I was walking through our area where we have people being watched for that 15 minutes after their vaccination. Ran into one of our women Air Force veterans who had worked on missiles, ran into a Navy veteran who was a boatswain on a Navy vessel for a couple of years, and then an Army veteran who was an immigrant, and he was a linguist. He was an interpreter when he came into the military. And so all of these veterans are really stepping forward and saying, hey, what we really need to do, it's not even just about me, it's about protecting the community. There's another Army veteran who said that. He says, I can't believe people don't want to get it. It really helps our community out. And so I just echo what those veterans, and I asked those veterans, I said, please talk to your veteran groups, talk to others, let them know to get vaccinated. We here at Amarillo are trying to follow exactly what the state is saying. So if veterans are calling over 65 or who are high risk, we are working to get them scheduled. And so we have been scheduling out. We are similar to the city of Amarillo. We don't know our week-to-week allotment, but we know that we have a general number we are hoping to get every week. And so that's what we're scheduling for. And so please call, get scheduled here. If you got it at the Civic Center, thank you for getting vaccinated. Please let our team know. We're continuing to do the vaccination. Now, one thing that will change is one of our buildings that's been under construction completed, and we are getting it. Rather than moving the team there that was going to move there, we are going to set that up as our new vaccination clinic area because it gives us more space. If you've been to our vaccination clinic area, we were using space already used for other visits, and so it made it pretty tight, and it's hard to do that social distancing. And so what we're going to do is we're going to use one of the new constructed buildings that's behind the hospital. We'll give instructions on how to get there, but I just want to make sure people know that it will be in a different location starting next week. We mentioned several things. One of the people I want to recognize is our pharmacists. Yesterday was National Pharmacist Day. Pharmacists have been at the forefront of this combating COVID-19. We mentioned our frontline healthcare workers, our nurses, our doctors, and they frequently get mentioned. The pharmacists are those people behind the curtain. They're the ones who are working on those treatments, getting those treatments out, getting the medications out. And in many cases, those are medications that are under what we call that EUA, that emergency use authorization. Talk to any pharmacist. That is not simple. There's a lot of requirements when you use those medications. So, but the treatments, the monoclonal antibodies, the vaccines, they are absolutely involved. And so I just want to say thank you. We really appreciate our pharmacists and our healthcare community, and what a time to recognize them. Finally, I just want to thank Casey and her team, what they are doing at the Civic Center. Yesterday, myself and a couple of our team members got to go there and see what they have laid out. I have ran vaccinations in the military for many years, whether it be anthrax, smallpox, annual influenza. I will tell you, they are knocking it out of the park. They're doing it the way you should. And they're absolutely making sure that first and foremost is protecting people's safety and health, not just by the vaccine, but the way they are doing it, the actual performance of the vaccination. So Casey, to you and your team, and I know it's many, thank you. We really appreciate that. And I know some of our veterans are taking advantage of what you've set up. And so with that, I just want to say thank you and for this opportunity, and appreciate the City of Amarillo for allowing me to talk to my fellow veterans.
Thank you, Dr. Gonzalez. Now I'll go to City Manager Jared Miller. Mr. Miller, how are you today?
Doing good. Thank you, Dave. Just want to remind everyone the drive-through testing center remains open. If you feel like you have symptoms consistent with coronavirus, call the public health hotline at 378-6300. They will assess you over the phone and refer you to the drive-through testing site. If you get referred to the drive-through testing site and you don't have transportation, or if you want to come get a vaccine and you don't have transportation, please call Amarillo City Transit at 378-3095. They will get to either one of those locations for free, no charge, both here and back to your drop-off spot. Right now, we are continuing to operate under two primary governor's orders, GA 29 and GA 32. GA 29 is the governor's order that when they're out and about, when they're within 6 feet of people, to continue to wear face. So we need to continue to do that. That's one of the biggest things that's enabled us to drive our hospitalization rate we have. There's more things that we can do, and I'll talk about that in just a moment. GA 32, as an area of high hospitalization, where our hospitalization rate has been higher than 15% for more than 7 days, it's been quite a bit longer than 7 days at this point. We are limited in our businesses currently to 50% occupancy, no more than 50% occupancy. As soon as we drive that number below 15%, we can expand our business operations to 75% of occupancy. So that's a big incentive for us to wear our face coverings and do a really good job of sanitizing, social distancing, and also getting these vaccinations done. The vaccinations, the more people we vaccinate, the quicker we're going to be able to drive that hospitalization rate down, because the more people in town are not going to be susceptible, or they're going to be significantly less susceptible to the virus. I think it's important to note when we're talking about vaccinations, and it's important for me to note, to throw out a really big shout to the team that's making this whole thing possible. Anytime we're operating over there, and I think there's a lot of people in town at this point that have been through the vaccination station over at the Civic Center, and I think everyone's going to agree with me. We have over 100 employees over there when we're operating. We probably have around 125 when we're max staffed, when we have people assisting us from the state to do vaccinations and things like that. We have those 100 staff members. They are tireless. They are creative. They've come up with so many great ideas to maintain a positive mood. The attitude there is great. Just it's a lighthearted event. You would think it'd be heavy and depressing, but it's really not bad. It's fun. Everyone that's gone through has been shocked and amazed at how efficient the operation is, but more than that, just at the positive attitude of the team. So I want to say thank you to our Amarillo team out there that's making this such a successful event. And it's not just how many shots we get in people's arms, it's how people feel when they leave. They're really pleased with their city organization. So the more people we can get out there to get a vaccination, the better we're going to be as a community. 1,500 people a day, and that's a slow day. We can do more than twice that in a day. So the more people we can get out there, and the faster we can get you out there when we have vaccinations, and we'll let you know when we do, the faster our community is going to get to that point that the mayor was talking about and that the doctors have been talking about, the point where we're significantly less vulnerable to coronavirus. So thank you to the team for making this really effective vaccination site possible, making it happen. Thank you to the community members that have come out so far. And I just want to encourage everyone, when we have vaccinations, come on out and get them, because that's going to help our community. That's all I have, Dave.
Thank you, Jared. We're now going to open it up to questions from our media members who are in attendance. You have a question for an individual member of the panel or the panel as a whole. That's completely fine. Let's go and start with Dalton Williams of KVI Channel 7. Dalton, how are you today?
I'm good, thank you. So my first question is for Casey. You had talked about the number of vaccines that we had received as a city. How many of those were Moderna and how many of those were for Pfizer?
So here at the City of Amarillo, we have received all Moderna vaccine.
Okay, so that kind of leads into my next question. We're getting kind of close to 1A, needing to get their second dose if they haven't already gotten their second dose. For those that got Pfizer, what's the kind of the process for them getting that second dose of COVID vaccine?
So they'll return back to the location that they received their first vaccine, take their card, and they'll receive their second dose of vaccine. And for the Pfizer vaccine, it's 21 days between the first and second. Moderna is 28 days. You don't want to be early. It's okay to be late. So for all the procrastinators out there, this is your time to shine. You don't want to be early, but you can be late. So Pfizer is 21 days. Moderna is 28 days. So return back to the location, especially for that Pfizer vaccine that you got your first dose.
Okay, thank you, Casey. And then my next question is for the doctors on the panel. Y'all had expressed concern about our high positive COVID cases. Were we kind of expecting this at all seeing going forward, like seeing that we have vaccines now, were we expecting the cases to continue to steadily rise, or we were expecting them to fall from these vaccinations?
Well, what we will see eventually is that the cases will fall. I think it's still too early to really make some sort of real judgment about why our cases are saying stubbornly high was my, I think, my words that I used. But eventually what we will see is that the more people that get vaccinated, those numbers will fall.
Okay, yeah, and then that's pretty much all the questions I have. Thank you all so much for allowing me to be here today.
Thank you, Dalton. Let's now go to Aaron Langston of KAMR Channel 4. Aaron, how are you today?
Pretty good. How are y'all?
Good.
First question is for anybody that's pregnant and maybe wanting to get the vaccine, is there any concerns for pregnant women in either one of the vaccines?
So pregnancy has been listed, in fact, it has been listed as one of the chronic conditions that would be included in vaccination, although that particular chronic condition will end. So yes, so if you are pregnant, it is recommended that you are vaccinated. I do think it's a great idea, if you're concerned, to visit with your physician about that, but it is okay for pregnant women to be vaccinated.
All righty, thank you very much. And with our numbers decreasing, at least from November and October in the hospitals, and the numbers increasing elsewhere in the state, is there a possibility that we could be releasing or having to send our RAC resources elsewhere in the state?
Yeah, Aaron, so the answer is yes. In fact, we've had those conversations with the RAC as to what we might anticipate with regard to some of the timing of maybe some of the nursing staff being demobilized to other parts of the state. We have been assured that we will have, for sure, probably upwards of a month or more of a lot of these nurses staying with us. But yeah, that is a very real possibility with some of the big cities now being much more active.
And roughly about how much staff would y'all lose once they're pulled away?
And in Northwest, again, I don't think we'll lose them all at once. I think it'll be a gradual demobilization, but we still have upwards of over 150 nurses coming from other parts of the state and the country right now helping us.
Yes, and it's similar at BSA. We've had that many nurses as well. We continue to run a fairly large number of RAC staff, not only nurses, but respiratory therapists, some techs as well. And a couple of physicians that are helping us weekly with our hospitalist service that manages most of our medical patients. So again, it will be hopefully a gradual decline in that support. But we are concerned about staffing voids because of the number of staff that have also traveled to work elsewhere. And it is a potential concern for us.
All righty. And are there any new drugs that are being used other than the ones that y'all talked about, the remdesivir, the BAM infusion, and stuff like that?
No, not really.
Yeah, not that we're using Northwest. No.
No, that's really the gamut right now.
All righty. I think that has me covered. Thank you very much.
Thank you, Aaron. Let's now go to David Gay of the Amarillo Globe News. David, how are you?
I'm good. Good morning, everybody. Just a clarification from a media member's previous question. For the Moderna second doses at the clinic, have those started to be delivered yet? And if not, when are those expected to be delivered and start being given to people?
So we have not received the second doses yet at the Civic Center clinic, but it has been scheduled. And so we expect to receive those starting the week of the 25th. And so everybody needs to look at their card, and whatever date they received their first dose, at least 28 days needs to pass before they receive their second dose.
Okay, thank you for the clarification. And just another question regarding the BAM Center being moved with the new space across from City Hall. Is there more space to give patients this infusion rather than the tent setup between the two hospitals?
That's a great question. So we do have more physical space. We don't yet have more supplies or more staffing. And so right now we have we're scheduling the same amount of people, but if we start to get additional referrals, then we do have the ability to scale up if needed, but we will need to work on supplies and staffing for that. So the answer to that question will probably be yes and no. But great question.
Sure, absolutely. And on that is once the supply of the BAM is diminished, I guess how do the hospitals and how do the city get more of the treatment?
So it's truly a partnership, and so we work with both of the hospitals, Northwest and BSA, to receive that medication. So I can let them talk about the actual supply, but we are working together on that with that medication. So I'll let them talk about the supply.
Yeah, our allocation is based upon how quickly and how efficiently we're using the drug is what we're being told by the state. So it's important for us to make sure we're doing prompt reporting, just like the vaccination process requires prompt reporting. And we have augmented the use of these antibodies at BSA in addition to working with the city in the tent location previously to utilize most of our allocation. We still have some left. We're told we're getting some more, and we're going to continue to use this for people that qualify.
Yeah, I would say similar to what Dr. Lena was saying, just to keep in mind, this is coming from the state, not through our normal pharmaceutical distributors. So yeah, we are very dependent on that one source, but so far my lead pharmacists have told me that they have not had any threats about not being able to get more in a judicious way.
All right, that's all the questions I have. Thank you guys. Have a good rest of your week.
Thank you, David. Let's now go to, if I'm not mistaken, Kevin Welch of KFDA News Channel 10. Kevin, how are you?
I'm good, Dave. Thank you. Dr. Milton, I guess early on we heard about vitamin C and D and zinc usage as possibly being effective in at least mitigating the risk. Is there new guidance on that?
No, there's no new guidance on that, and I've never seen any guidance that would be convincing that that was helpful.
And Dr. Lementier, can you give us a little insight into how the donation to the city, the vaccine donation happened? How'd that come about?
Well, I think the biggest reason was because we looked at the number of employees that we had to vaccinate. We saw what our allocation was initially, partly through what we were collaborating with Northwest and Texas Tech in terms of providing us some of the Pfizer vaccine that first came, and then getting our subsequent allocation of Moderna, and then understood through a polling process approximately how many of our employees were going to be desiring vaccination. And then we obviously saw that we had an excess. And then we also looked at logistics of how we were going to be vaccinating those people who qualified and understood that the city had a very good process to get vaccine out quickly. And we also wanted to make sure that for Amarillo as a whole, we were able to utilize the allocation quickly. I think everybody on this panel would tell you that as well. And therefore, it just made the most sense to say, put this in the hands of the team that can administer it the fastest to the most appropriate patients. And we still were able to satisfy, our employee needs here at BSA and those of the RAC support staff and the medical staff. So it really worked out well in terms of how it was planned.
Okay, and Dr. Weiss, you mentioned people coming from outside the region to get vaccines. We've been hearing that too. Can you elaborate on that?
Well, just, we're hearing, obviously we're hoping that some of our regional towns here can feel free to come and get vaccines. But I've even heard of some families here that have brought in relatives from other parts of the state and even outside the state, and these are people who qualify under the phase 1A or 1B to be able to get the vaccines, just because it's so much easier to get it here than where they live.
Okay. And I guess, Casey, can you tell me what the testing volume has been like at the city site?
Yeah, it's been steady. I don't know the exact numbers for every day, but I know it's been steady. So we certainly have capacity to test anyone who needs a test. And so if you do, our call center's waiting to serve. And so we've certainly been steady. I would like to talk just a little bit and just thank BSA for their vaccine. We were able to get that vaccine to people who needed it very quickly. We've already used all 2,000 doses that they gave us, and so we couldn't thank them more. I think what you're seeing here is a partnership that is like anything else. And so that is one of the things that makes Amarillo so successful, is the fact that we work together, the fact that we do that very quickly. And so I appreciate BSA for their generosity and just the members on this panel.
That's great. That's everything today. Thank you all.
I'm sorry, Kevin, can I? Oh, go ahead.
You go, Kate. You finish your thought.
I need to throw one more thing in.
Sure.
So we will have demographic information soon for the clinics that we have run. So we're caught up with all of the data entry into MTrack. That's the required entry that we need to do within 24 hours of any vaccine that's given. And so we have 18,000 pieces of paper for all of the vaccine that's been given. And so all of that data entry has been finished. But now we're doing more data entry so that we can have data to share with our community on what the vaccine uptake looks like. And so we will have more information soon so that we can answer some of those questions. How many people have we given vaccine to that live here? How many people outside of our community, and what that breakdown looks like? And so we will have information soon. Our team is working on that now, but they've got 18,000 pieces of paper to plow through, so they're working on that.
Doesn't sound like fun, but I look forward to it. Mayor?
I was just going to add to that, Kevin, that so many people have asked me, what do you think we've learned from the year 2020? It's been such a hard year. And you hear people saying very inspirational things like, every challenge makes you stronger and things like that. But this is the perfect example of looking for the bright sides of facing a challenge together. And I'm looking at this panel of people, some of them, I don't think I've even met you in person yet, Dr. Gonzalez. But aside from these press conferences, we do status update calls together. And this team of people that you see once a week on this press conference is an actual team that did not exist really a year ago. I mean, the channels were there. They just weren't connected. They weren't interfacing. They weren't really talking to each other as frequently and as often, and strategizing and anticipating challenges. And that's part of why the vaccine clinic has been such a success, is because it was discussed months ago and anticipated and implemented by the time the vaccine got here. And that's what this team is doing so well together. So the leadership at the hospitals, as well as Texas Tech, and just watching us work together and have time to form these team relationships is a real benefit that's come out of this COVID challenge. And I do want to thank you, Dr. Lamentier. I want to thank BSA for the way they so easily gave that vaccine into the community. But Northwest would have done the same, and so would the VA. And so I know that with confidence, and that's what I would call a really beautiful silver lining out of this challenge that we've been going through together. I just wanted to add that, Kevin. It wasn't really related to your question. It was just out of my heart.
Oh, it's all good. Thank you.
Thank you, Kevin. This now concludes our weekly news conference for the latest in COVID-19 information from the community. We want to thank all of our panel members who do this every week and take the time to provide this information. Thank you. This is David Henry, Communications Manager for the City of Amarillo. We will see everybody next week. Thank you.
You.